Recording.
So, good afternoon. My name is Frank Hawkins. I am the Director of Education and Outreach at AIDS Delaware. AIDS Delaware is a nonprofit organization. We address the issue of HIV and AIDS in the state of Delaware. And we are in each county of Delaware providing comprehensive services for those individuals who live with HIV or have progressed to the condition of having AIDS. So I am the Director of Education and Outreach, and I've been asked by a college student, to go over some things about HIV and AIDS to help clear up some misconceptions about the disease, so that people can be more informed about making choices related to sexuality and what have you. So what I'm going to be doing today is pretty much a basic HIV 101 is what we're called. So it's going to be pretty basic. It's not going to be too deep, I hope. After watching this, if you have any questions about anything that I said, I'd like for you to have my number. So my number is 302-652-6776. And you can reach me at AIDS Delaware and give me a call about anything that I say today. If you need more clarity on the information, please feel free to give me a call. Again, my number is 302-652-6776. All right, so let's get started. The first thing that I've been asked to discuss, I have a list of questions or comments or statements. What causes AIDS is the first question, and I'll put that so you can see that. What causes AIDS? So I'm going to answer that not generically, but I'm going to answer that in a manner that is digestible for pretty much anyone. All right. So before you understand what AIDS is, I think you have to understand what HIV is, because HIV is the virus that progresses to the condition AIDS. So what HIV stands for is human immunodeficiency virus. Now, simply put, what that pretty much means, and I'm going to try to bring this a little bit closer so you can see what I am writing, and I don't want that to fall. So let's so I'm back. All right, we had some camera technical gadget difficulties here. All right, so that's the first thing I want you to do is, so I wrote up here on this board, what is HIV? So HIV stands for human immunodeficiency virus. Simply put, what that means is that HIV is a humanly transmitted virus that infects only human beings. So you don't get HIV from animals, bugs, mosquitoes in particular. Most people have that misconception. It's only humanly transmitted, which means you have to engage in some type of behavior for HIV to be transmitted. It's an immunodeficiency, meaning it affects the immune system, causes our immune system to become deficient. Our immune system is our fighting system. If your immune system is deficient, that means it's not functioning properly, and therefore you become susceptible to a lot of other virus, bacteria, germs, and that you would normally be able to fight off. So at this point, it means that your immune system has been compromised, and it is a virus. So let me just draw this timeline. So when a person is initially infected with HIV, right, we call that the initial infection. Simply put, what that means is that once you are infected initially, you will exhibit 2 weeks later flu-like symptoms. What that means is that you will become sick and you will think you have the flu. Most people at this point don't go to the doctor because they think they're HIV positive. They go to the doctor because they believe they have the flu. The doctor thereby gives them some antibiotics and other medications to take away the symptoms believed to be the flu. The person goes home, they get well, they return back to work or go back to school or wherever they're going, and their life, they go back to their normal everyday habits and they get better. Most people at this stage never think they have been exposed to HIV, and therefore they go on living life as if everything is okay. Then we go to what's called the asymptomatic. During the asymptomatic stage, people are not showing any signs or symptoms, and you can be in this stage for 10 years or more. So what do you think is dangerous about that? You're exactly right. Yes, you can. You can infect other people and not know it, or you can be spreading the virus to other people, not know it. The person that you're with may look healthy and be looking very well, but they may be carrying the virus and not know it, and therefore we have the opportunity for HIV transmission to occur. All right, so this is a very important stage right here. This is one of those stages that I stress a lot when I'm talking in public to individuals, because as human beings, we meet people most of the time on what we see externally. And because of that, just seeing individuals from what we see on the outside, we don't take in consideration that the person could possibly be infected with HIV. So the asymptomatic stage is very important because most people, again, stay in this stage for up to 10 years or more. All right, and then the next stage is a person becomes symptomatic. As you can see, the word is symptomatic, meaning they start showing symptoms. Symptoms like they start losing weight, they go into the hospital for pneumonia recurring, they start developing, skin lesions, which is a form of skin cancer, and a host of other opportunistic infections occur. So at this point, the person becomes sick, and most people, when they become symptomatic, kind of get an idea something's going on, strange, and they go to the doctor, or they go somewhere and get tested for HIV to see what's happening, and this is the stage where most people find out that they have acquired HIV somewhere. And finally, AIDS. Now, so AIDS is a medical condition. What is the difference between HIV and AIDS? HIV is an infection. AIDS is a medical condition that a person has acquired as a result of having HIV. So HIV stands for human immunodeficiency virus, whereas AIDS stands for acquired immunodeficiency syndrome. And what that simply means is that you acquired HIV that causes your immune to become deficient, and a group of things happens. Many things happen for a person to get this diagnosis. So once a person has AIDS, it is something that goes into their medical chart. Once they get well again, or they get back, they get rid of whatever the problem is. They still have AIDS. They don't go back to having HIV as a diagnosis. Once they have AIDS, that is the diagnosis that will remain in their chart. So once a person opens their chart, they will see that they have AIDS and not HIV. Okay? So I kind of hope that cleared up that question, which was, what is AIDS? I believe it was. All right? So, moving along. My next question is, what are some of the symptoms of the disease? Okay. Again, some of the symptoms that a person may have are, I'll take this off, and I'll leave this somewhere so that you can see it. Maybe like I'll put it on this side. Is that good? So symptoms. What are some of the symptoms that a person experiences? Weight loss. And when I say weight loss, I am talking about extreme weight loss. All right? So, well, you won't be able to see this on this side because of the way the camera is situated. But it's extreme weight loss. You lose about 10% of your body mass rapidly. You acquire pneumonia, and we call that recurring. So recurring pneumonia is if you have pneumonia 2 times in 1 year, that is considered recurring. Okay? So, and then you would probably, the doctor would probably encourage you to get an HIV test or do your blood work to see what's going on, why you're getting pneumonia. Some people have thrush in their mouth. If you have children, you probably know what thrush is. It's that thick white coating that babies usually develop in their mouth. All right? Some people develop herpes. Tuberculosis, easily susceptible, skin lesions on your arm, pretty much, or your skin, right? Night sweats, you just sweat at night. Right? So those are some of the symptoms. In many cases, people who are symptomatic, at this point, if you are exhibiting symptoms, you pretty much will go to the doctor to take care of these, especially if you have pneumonia. If you can't explain why you are losing weight, and you're not in the gym, you're not eating, everything is going well in your life, no stress, and you're just still losing weight and you can't explain it, and it's very noticeable. It's like you're losing weight rapidly, then if you go to the doctor and say, "Doctor, I'm just losing this weight," and the doctor will do a CBC or a complete blood count on you to make sure, they should do a check for HIV as well, just to see what is going on with you. All right? So, I believe that answers that question. What was the? You took it.
No, that was the question. Oh, symptoms of the disease.
The symptoms of the disease, right? So I answered, I believe, that question. All right. So the next question: what population is most at risk? Well, everyone is at risk. First, let me just say that everyone is at risk for HIV. If you are a human being, and you engage in unsafe behaviors, sexually or non-sexually, you are at risk for HIV transmission. Okay? But who is most at risk? Well, the population that we see most at risk are men who have sex with men, or as we would put it, MSM. Men who have sex with men are the population that we see increasing the most, especially in the minority communities, especially in African American young men between the age of about 18 and 25. We see that population increasing very rapidly. They account for a large portion of the HIV/AIDS cases that are reported to our state and to CDC, the government, federal government, what have you. So, and then after men that have sex with men, you have IV drug users, mainly African American, and then you have heterosexual women. So now when we look at that from a statistical standpoint, we look at it, the women, because women are more, it's easier for a woman to get infected by a man than it is for a man to get infected by a woman. Therefore, because we see a lot of men who are HIV positive, it can be speculated that these men have women and are transmitting HIV to women, which is why we see such an increase in numbers of HIV numbers. When it comes to communities, African Americans carry a disproportionate number of HIV/AIDS cases in the United States. In the United States, there are currently somewhere around 1.2 million people infected with HIV, but of the 1.2 million people, nearly half are African American. And so there's a disparity in the African American community. The numbers are not, we're 10th in our state here in Delaware. We're number 7. We're number 7, and so we stay in the top 10 for HIV/AIDS cases per capita, which is for us to be such a small state, we carry a high number of people who are HIV positive. So I think I answered that question, all right, of what population is most at risk. Is there a vaccine available? Not currently. All right, so that's pretty easy. There is not a vaccine currently available. Are they working on some? Yes, they are. We always get reports about the vaccinations, the trials that they're doing, but nothing has been released yet to say that we have a vaccination available or we have a cure available at this point. All right? Is it new or has it occurred in the past? I don't know what that means, but HIV is not new. HIV has been around since 1981. The first reported case was June of 1981. And just to give you a little historical data about HIV, so back in 1981 and prior, they really didn't know what was going on in the community of men who were having sex with men. A lot of people say the gay men. Yes, it was the gay community, and a lot of people did not have answers to what was affecting this community, what was killing these people, what was putting these men in the hospital, what was causing this community to be ravaged by such a devastating disease. And so at that time, the disease was called GRID. GRID stood, G-R-I-D, stood for Gay Related Immune Disease, because it was only thought to be a gay disease at that time. And as time progressed, people who were not gay, heterosexual and others, became infected. African Americans became infected, and therefore they knew that it was not just a disease affecting the gay community, and therefore they came up with the acronym AIDS. Again, AIDS stood for Acquired Immune Deficiency Syndrome, because they knew that it was affecting the immune system, because many of the illnesses or diseases that people were acquiring, a person with a healthy immune system would normally fight off these opportunistic infections. So that's how that came about. And as time progressed, a lot of attention from the media and others was given to the gay community, and the gay community mobilized and they strategized and they began to march and do other things to bring attention to this illness that was affecting their community. And as a result, we have many organizations, such as the one that I work for, AIDS Delaware, that was founded in 1984 to help as a solution to HIV and AIDS. And so the history of HIV and AIDS is really, really deep, right? Once you start reading about it, it's very, when you start looking at the history, who did what was happening, medication-wise, what was going on. I think it was very significant at that time. So one of the things, and I think it's very important, and I was going to talk about this, but I think it's very important that HIV is not only a sexually transmitted disease. A lot of people talk about it, oh, you have sex. Well, HIV is sexually transmitted. We know that. We know that you can get HIV from anal sex, oral sex, vaginal sex. Those are the three ways that people become infected sexually. But when we talk about non-sexually, how can you get infected with HIV? Well, sharing needles. Needles used for what, you may ask? Tattooing, body piercings, injecting drug use, people who are IV drug users, all right? People who, they may be a diabetic, but they share their diabetic needles with people who are drug users. Opportunity presents itself for transmission to occur. And so that's why we encourage people, we've been on this campaign lately, to encourage people who are seeking to get a tattoo, right? If you want to get a tattoo, please go somewhere reputable, which means go somewhere where they are being inspected by the Division of Public Health. Go somewhere where they use clean, sterilized instruments, that they have proper sterilization procedures in place for their instruments, and that all the facility itself is clean. All right? Because we hear a lot about tattoo parties, and tattoo parties are places that people go. To me, I like to call them, they're the underground tattoo places, parties. And people go to get tattoos, and a lot of times what we hear is that people are drinking, drugging at these events, and it's just not a safe environment for tattoos to occur, especially if a person is HIV positive in the audience receiving a tattoo, and then after them others go and the needle is not changed, nor is the ink changed. Well, that presents an opportunity for HIV transmission to occur. And the other way that we talk about it is mother to child. So women who are HIV positive are encouraged to not breastfeed their children, so that the child is not infected. And in our state, again, of Delaware, our care for our prenatal care is very, very good, and therefore we don't see a lot of women getting infected or who have HIV, transmitting HIV to their babies, because women in Delaware have to opt out of testing for HIV, which means that if a woman is pregnant, she has to say that she does not want to get tested for HIV. But what woman would want to do that? So those are the ways. And last, well, I guess I remember, so HIV is not high. Young people, our youth, don't carry a high percentage of HIV/AIDS cases. That's more of the older crowd. They may carry high cases of chlamydia, syphilis, and gonorrhea, pretty much chlamydia, but we don't see a lot of young people testing positive for HIV. Actually, we don't even see a lot of young people come in getting tested for HIV. And when I say young person, I'm referring to individuals who are between 15 to 18. So we don't see them coming in much to get tested. And that's why we go, here at AIDS Delaware, we go into high schools to provide HIV education to health classes, because we think and feel that it is paramount that these young people hear the information about HIV so that we can help them prevent from getting infected with the virus. So the last question I have is, does the disease present a significant problem for human population globally, or is it local? So HIV is not just a national problem. We know, and and you can always research this. HIV is a problem in the world. All right, December 3rd this year, December 3rd, 2016. December 1st. I'm sorry, December 1st is World AIDS Day. Okay, that's in the world. Everyone acknowledges World AIDS Day on December 1st, whether it be in Delaware or in South Africa. It is World AIDS Day. And we as an organization, we do our part to acknowledge that day as well by doing, an event to bring awareness to the illness and what have you. So when you think of infections, the most people that we see infected are in sub-Saharan Africa, right? And countries like that. They carry a high percentage of people who are living with HIV. I have friends that go over to Africa and they come back and they talk about the conditions in Africa, the children, what's going on. And it's just over there they have a lot of orphans and orphanages. It's because a lot of children, their parents have passed away from the virus. So that's one of the things that we encourage people to do here. Get tested. Know your status. The reason that it is important to know your status is because if you are HIV positive, you are in a better position to get treatment. You're in a better position to know. You're in a better position to help yourself. The testing process is simple. You just come in. You don't even have to make an appointment here at AIDS Delaware. You come in. One of our counselors will bring you to the back in our private room. All the information that is discussed is confidential. You need identification, and once you give us the identification and you consent to being tested, we will talk to you about what will happen during the testing process, how long the tests take, what the test results mean, and we will also do a risk assessment with you to determine what risk you have put yourself at for coming in contact with HIV. So we're going to ask you, what kinds of sex have you had in the last 6 months? Was it safe, unsafe? How many partners have you had? Did you use any needles? And things of that nature. And then the testing method itself is very simple. The testing method is simply, we stick your finger, get a little bit of blood, take that blood, put it into the specimen that runs the test, and you will have your results in 10 minutes. So you don't have to wait 2 weeks for your results. You get your results in 10 minutes. So as you're waiting, I'm waiting. All right? So as a trained, certified individual, I am preparing myself as well to assist you along the way if this result was to be positive. One of the questions that I ask you before we even initiate the test is, what do you think your response would be if this result was to be positive? And if you can't give me an answer before I administer the test, then we're going to continue to talk about that before I give you the test, because it's very important to me and to you to understand what would your reaction be, because we want to make sure that you don't hurt yourself or hurt others, if this result was positive. If the result is negative, then we will look at what behaviors brought you in and how can we help you change the behaviors. The counseling part that we do at AIDS Delaware can always be ongoing. You can always come in for counseling to help change some of those risky behaviors. And if you need our support with anything, we're more than willing to provide you assistance and support. So, I've been talking now for 29 minutes and 21 seconds. And I hope that this time has been very informative to you. Again, if you have any questions about the information that I just relayed, please feel free to give me a call at 302-652-6776. And my name again is Frank Hawkins, and I want to thank you for taking the time to listen.